This is one of the many visits that we're going to be doing. Last week we started off in Tshwane district, where we went to see a hospital that we have decanted, which is now dedicated to COVID-19. And we also went to Kalafong. It's just to see all the facilities that we are preparing and preparing for them to be able to deal with the COVID-19. So this is also one of those part of the visits. Here we are hoping to start off with 500 beds, which are going to deal with both the quarantine patients and isolation patients. We're going to phase it in as we go to build up to a point where it can be able to carry more than 2,000 patients. At the moment, we are building capacity in our hospitals for those who will require to be admitted and require medical attention. Remember, the isolation, it means the individual must be placed in an individual room, which is well ventilated and well actually covered. And those who are in quarantine are normally the patients that are negative, waiting for results, and which these are an open plan type of arrangement for them. Just in terms of the number of the population, a quarter of South African people are found in Gauteng. You know, the majority of all the diplomatic missions and offices are in Gauteng. The biggest port of entry into Africa, not only in South Africa, is in Gauteng. That is OR Tambo. So just by that on its own, it's a big areas and factors that influence our numbers. The challenges, they've been there, but we're working very hard to overcome them, you know, in terms of the pressure of the shortage of PPE, which, like we've said, we are working on it to ramp up the stocks that we have. This morning we received donations from the Bank of China and the People's Republic of China. Last week we received stock from Motsepe Foundation, and the individuals are still coming. The stock that we've procured that arrived on Saturday, some of the stock is coming in today. So those are the few things that we are preoccupied with, because without healthcare workers, without protecting them, we won't be able to overcome this pandemic. We are procuring more on the staff from the local business. We've said that we have now a link that we have put up for those who've got those masks, who've got factories that they can produce, to put up their names and put up the information in the link, and then we can be able to be in contact with them. Part of our effort is also to be able to deal with the economic aspect of the pandemic. So contributing to the township economy and contributing to the economy of Gauteng is much also part of our plan, and it's important for us to do.